Let's understand what is narrowband imaging or NBI and why is it important for diagnosis in laryngology. Now let's first look at the two pictures on the screen. The one on the left shows the larynx visualized using normal white light endoscopy, while the one on the right, which appears blue-green, is visualized using narrowband imaging. In normal white light endoscopy, we use a full spectrum of visible light, while in narrowband imaging, we use special optical fibers to narrow the light into blue and green wavelengths of approximately 415 and 540 nanometers respectively. We use a special endoscopic system where we can switch the light from normal white light to NBI by just pressing a button on the scope. Now, why are these specific wavelengths important? Blue and green wavelengths are very strongly absorbed by hemoglobin present in the blood vessels. So, when we use NBI, the blood vessels become much more clearly visible and hence the superficial vascular pattern and mucosal pattern becomes more enhanced. When you look at this NBI picture, you can see the blood vascular pattern more clearly. Now, how does looking at these blood vessels help us in diagnosing cancerous lesions? We all know that in malignancy, neoangiogenesis, that is formation of abnormal new blood vessels, takes place. And these abnormal blood vessels are then very easily identified with the help of NBI compared to normal white light. The most commonly used classification for NBI in laryngology is Neel classification, which is based on the presence of the intraepithelial blood vessels and the identification of the intraepithelial papillary-capillary loop. Now let's go to each types. In type 1, we can see regular thin blood vessels parallel to the epithelium with oblique capillaries suggestive of normal mucosa. In type 2, the same vessels appear a bit dilated or enlarged, which is suggestive of inflammatory lesion. In type 3, we can see some white lesion which is covering the blood vessel, and that can be because of the presence of leukoplakia or hyperkeratosis. Now in type 4, we start seeing the IPCLs, which are small brown spots that we observe below the mucosa. However, if you observe, they're still regular in pattern and is still suggestive of a benign disease like RRP, that is respiratory papillomatosis. It is from type 5 onwards that these patterns or IPCLs become more irregular, distorted or chaotic with more solid or hollow appearance or increased tortuosity, and that is when we can think of dysplasia or malignancy. Another important and probably much simpler classification is the European Laryngology Society classification, which just divides the blood vessels into the longitudinal or perpendicular pattern. For more such information on laryngology, subscribe to the channel.